can see this is very flexible. In gynecology, most of the imaging we do is with an internal ultrasound, or what we call a transvaginal ultrasound. This is an example of a transvaginal ultrasound probe. Of course, when we use this, each one is used for a separate patient, sterilized in between, and is covered with a condom-like protector, which is to obviously to eliminate any chance of infection. So we use transvaginal ultrasound to be able to get really close to the organs that we're interested in evaluating, which generally are the ovaries, the uterus. Fallopian tubes usually are not visualized on ultrasound if they're normal. If they're blocked and filled with fluid, that could be visualized. Other things that might be used, not really in the evaluation, but potentially in treatment. One treatment that is often one of the first line treatments that might be offered in couples who have open fallopian tubes and a reasonable sperm count would be something called intrauterine insemination. Usually intrauterine insemination is coupled with monitoring of the development of the eggs, which we call cycle monitoring, which is with vaginal ultrasound and blood testing. And very often it's coupled with some low-dose fertility medication to slightly increase the number of eggs. At the time of the intrauterine insemination, it's actually a very, very simple process. If there's a male involved, he would produce a sperm sample by masturbation. That sample would be brought to the andrology lab where it would be processed so that the motile and really healthy sperm is separated from the rest of the sample. And then that very, very tiny sample, it's usually about 0.4 of 1 mil, gets drawn into a catheter. You can see this is very flexible. And that sample is placed into the uterine cavity by putting a speculum within the uterus, as when a woman would have a pap test, and the catheter, which is obviously not sharp or stiff at all, just transverses the uterine cavity, and the sample is placed.